Good afternoon. It's my pleasure to present you the main results of a recent study that we published in Human Reproduction. It was mostly regarding perinatal outcomes, so pregnancy outcomes after IVF. The main question we were tackling was to see whether freezing an embryo could hinder pregnancy outcomes and cause, for instance, more or less prematurity or more or less preterm low birth weights. So what we did to try and disentangle this and to discover the main answer to this question was to use the oocyte recipient model. Why did we want to use those that receive eggs from donated women who donate them? We wanted to do that because that way we could be sure that the stimulation that we give to women who are using their own eggs wouldn't cause a confounding factor. This way, what we did was compare the outcomes of women receiving embryos that were freshly transferred versus those that were frozen transferred. And what we noticed were that the outcomes in terms of prematurity and birth weight hardly did not vary. This is an important finding because that gives us assurance of freezing embryos, that we can do it in a safe way. Moreover, it was also important because it allowed us to also determine a comparison between both natural cycles and artificial cycles, which are routinely done in frozen embryo transfers. And there we were able to confirm previously found results which showed that an artificial cycle may give slightly higher risks of hypertension during pregnancy. This will help us as physicians to be able to determine better what sort of strategy to give to each patient.